On this holiday Monday, we are taking stock of this COVID crisis a little differently than we usually do, and we're going to focus on three things: what we know to be true, what sounds true but probably isn't, and what may be true today but may not be in the end. Joining me with their insight and understanding, infectious diseases specialist Dr. Lenora Saxinger and Dr. Isaac Bogosh. Hello to the two of you. And Dr. Bogosh, start us off just on that first question: what we know to be true at this point.
Certainly at this point in time, we know that this virus is deadly in the elderly. There's just ample data supporting this. We've seen this in multiple countries. We've seen this from the very beginning of the epidemic. We see this now in Canada. Currently, between 80 to 90% of the deaths in Canada are in those over the age of 60, and people in the age range of 80 plus are even more disproportionately affected by this virus. So that's certainly something we know to be true.
Yeah, and I know we've talked a lot about all the ways we can protect ourselves, hand hygiene, not touching your face. Dr. Saxinger, what else comes to mind for you?
For the things we know to be true, I think it's becoming clearer that this is a virus that is transmitted most commonly by close contact, often indoors, so you're face-to-face with a person who has infection. And the epidemiologic descriptions often involve household transmission. And so I think that's providing us some reassurance about ways that we might reduce spread as we move forward, but also areas that we might need to focus in preventing spread for people who have to be indoors and in close contact with other people, such as people who work in food processing industries and the like.
And that's been such an important question because we've gotten so many questions from people wondering, can I get sick by passing someone, in the middle of the street, that sort of thing. And it seems like universally the answer to that is probably not.
Yes, I think that is still the case anyway.
Dr. Bogosh, what about things that sound true, sound plausible, but aren't?
Yeah, I think a neat way to focus on this one is with the drugs that we're using or may be using to treat this infection. And of course, we've heard of lots of different drugs: hydroxychloroquine, remdesivir, lopinavir, interferon. The list goes on and on and on. Many of these drugs have been touted to be miracle cures or certainly going to work. And we're sitting on the cusp of having the results of many large clinical trials the results are going to be available very soon. And we're going to see shortly that some of these drugs indeed will be very helpful in treating sick people with COVID-19 infections. But I think we're also going to see that some drugs are not going to be effective whatsoever. So maybe some drugs that were touted to be fantastic cures, they might not pan out to be so.
And Dr. Saxinger, things that sound true but probably aren't true?
I was kind of sticking with the transmission theme I'd started with because I'm noticing people are still very concerned about airborne transmission or aerosol transmission. And there are a number of lines of evidence that people point to suggesting that might be a big deal and that would change our understanding of the disease. But as we actually look at the real world experience to kind of counterpoint some of the dye-based or airflow-based type studies, it really looks like the real-world experience isn't showing that to be a major mode of transmission. So there's some evidence that looks compelling, but I'm still thinking it's not going to turn out to be highly likely to be a major airborne spread virus.
Right, and yeah, that's been a big one that we've been getting an awful lot of questions about. So Dr. Bogosh, this last question of things perhaps that may be true today, but are subject to change.
Yeah, I mean, I'm really interested to watch how this pans out. I'm thinking about the true role of asymptomatic people. Now, we know that asymptomatic people can get this infection, but what we don't know really is what the true role of asymptomatic people in transmitting this infection. And what's the problem with this is we count asymptomatic people as people who truly have no symptoms throughout the whole course of their illness. People who might have mild symptoms are misclassified as asymptomatic a lot of the time. And then there's people who we call pre-symptomatic, meaning they have no symptoms for the first couple of days, but then they go on to develop symptoms of COVID-19 infection. And the problem is all these three groups of people are sort of collapsed into one in many instances and called asymptomatic. It's important to tease these apart and to see what the true role is of each one of those three groups in transmitting this infection. So we all call this asymptomatic now, but it might not actually be the case. We just need to see and look into this a little bit further to see what each group, how each group plays in the transmission of this infection.
Right, and Dr. Saxinger, so much of the context, so much of the information is so fluid these days. What's your take on this last question?
I think that one thing that interests me just now is the role of non-humans in transmitting as well. And so we've seen some techniques that you could isolate virus from animals, and that maybe some animals might transmit to other animals. And there's a proportion of cases in which we don't know how the infection was transmitted just because we have incomplete epidemiologic contact tracing data. So I think something to kind of just keep half an eye on would be the role of animals in transmitting infection, because that might dictate to some extent how close people get to their pets, nose to nose, et cetera. I don't think that this is going to change the way that we interact with our furry friends necessarily, but I think it's something to keep an eye on in terms of whether this turns out to be an actual concern or not.
Doctors, I always love learning from you. Dr. Saxinger, Dr. Bogoch, thanks so much.
Anytime.
Thank you.